Mesa started collaborating with us in 2018, and they were the first in the country that I know of. And they actually changed their policies to divert calls from 911 over to crisis. So we saw a large increase back then, and then the city came to us and said, how can we do better? And what they decided to do is co-locate a staff here. So our crisis specialist is sitting in the contact center up there, and they're actively coaching and consulting with the staff to help them figure out which calls can come over, which ones are safe, and help them divert those calls away from 911 and the law enforcement over to the crisis line.
And Solari told us these are what we do. We do people in active psychosis, we go out on suicidal people, we go out on substance use problems, we go out on parents that need help with their children. So once we figured out what they were willing to manage, our triage got bigger. And that's kind of where we are today, is this whole variety of different calls that we know are not police calls. We want to get the people the help they need. And oftentimes, while we have training in this, we're police officers first and foremost. And so we want mental health professionals, behavioral health professionals to be the ones to help the families that need us.
Mesa realized there's already a best practice crisis line in the area that's serving their citizens, and they said, let's utilize that, let's tap into that, and let's use that system to get the best care for the people in our city.
The more officers that we can have out there doing public safety, that's what our job is public safety, preventing crime. The less we have handling behavioral health calls that could be handled by behavioral health professionals, the more we have doing public safety. So it kind of helps everybody.
When people come to us for help at their worst spot, there's a really beautiful ability to help them make a lot of change in their life, and I think it's really special that we get to help them in that situation.